Dave Popkin, Seton Hall basketball. Hope everybody's doing well in this off season. Thanks for joining us. I'm being joined by Arielle Scarpelli from the Mental Health Association. MHA is a longtime sponsor of Seton Hall Athletics and a great partner in the community. And they have MCORT 988, the Mobile Crisis Outreach Response Team. Since the organization started MCORT, how has it evolved?
So as you know, Mobile Crisis Outreach Response Teams, or MCORT, is part of the continuum of care for individuals that call the 988 Suicide and Crisis Lifeline. At its core, it's about meeting people where they're at in person to provide support. When someone calls 988, we're going to respond in 1 hour, de-escalate the crisis, reduce emergency responses and hospitalizations when it's safe to do so, but most importantly, link people to services as quick as possible. We've also evolved by just naturally with the program. As we've seen each single dispatch or individual person, no one crisis is the same, and we've learned along with them, and that's given us opportunities to just really meet people where they're at with the right types of supports. We've also evolved by now being 24/7 for the past 10 months. You can get in-person support any day at any time. That includes holidays, inclement weather. We are here through the winter storms, and any other unexpected events. We've also seen more people since the beginning of the program. We've had a 63% increase from the start of the program to currently.
It's often important to reflect, and you're a year in, MCORT 988. What are the most important accomplishments so far in your mind?
One of the most important things I value about the MCORT team is just the team that we built. We have peer support specialists and crisis outreach responders, and the way that they're able to connect with people is just remarkable. They really give everyone an opportunity to be understood and supported for why they called 988 that day. And really the most important part of the work that we do is that human connection. The teams are also able to just think of really unique ways to reduce barriers and gain better access to services. For example, we had an individual who was experiencing homelessness. They had 2 dogs that they were caring for, and those dogs were their family. That was not something they were willing to give up. But it did make things more difficult. They weren't able to go to appointments. They had difficulty finding jobs. They were unable to really manage day-to-day responsibilities. So the teams understood that, and they stood by that person and really worked with them to figure out what resources did they need. And that person identified needing mental health support and maybe some assistance with housing, case management. But they also took the dogs as one of their priorities. So they also came up with a plan of how to care for those dogs. And they were able to find a plan that worked for the individual, and the individual was able to go to those appointments and start to rebuild her life.
Working on these projects takes such creativity and patience and kindness. It's tremendous work. What has surprised you most about the community response to MCORT so far?
I was really surprised about just how invested and how supportive the community was about the program. Traditionally, crisis services usually means hospitalization. So we did have to do a little bit of education to dispel those assumptions that this is a different type of crisis response. Our goal is to not hospitalize individuals, it's to keep people in their home when it's safe to do so. So we did that by educating community partners, local law enforcement, faith-based organizations, and honestly just the general public. And the feedback was really positive. People really wanted to know, how can they help? What can they do? Can they hang flyers up? Can they have brochures? So they can also help get the word out there, which just showed the community was ready for a program like MCORT and ready to embrace it.
So why do you think it was important to bring a program like MCORT to this community in the first place?
I don't want to sound repetitive, but it really is all about accessing services and breaking barriers. We are meeting with people on potentially the worst day of their life or one of the worst moments of their life. And MCORT gets to go out there and meet with each person one at a time and bring back hope into their lives. We're also meeting with people who maybe aren't ready for traditional services, but maybe they are ready to just meet with someone, maybe in their home, maybe another place where they feel safe. And we're going to come in and start to plant those seeds about what services might look like and what types of things they can engage in. And if maybe they're not ready that first time they call, hopefully they leave knowing that when they are ready, MCORT will be there to support them through the process.
What does success look like for MCORT after 1 year?
Year 1 was all about getting the word out there, making sure people knew about the service, and we have seen people understand it. they use it, and they feel comfortable with the services. So year 2 is a little bit more, and moving forward is just more of the same. More community engagement, more bringing awareness to 988, continuing to build on those partnerships that we already built on, expanding our network where it makes sense. But at the end of the day, it's meeting people where they're at and instilling hope.
If people want to learn more about the Mental Health Association in general or MCORT 988, how would they do that?
They can go to our website, mhainspire.org.
Okay, Arielle, always good to see you. Thanks so much.
Good to see you. Thank you.
Okay, that's Arielle Scarpelli, Mental Health Association. We'll see you soon.